Hi everyone online. I'm not David, as you can tell. So I'm just here to introduce David's away in Edinburgh today, he's maybe online, but just to introduce our speakers for our skills development workshop today. So we have Alastair Wilson and Sinead Traynor from MVLS Research Compliance and Governance. They'll introduce themselves properly and give you the right team names, and Matt Mathen then from the Research Information Officer. That might help with data management plans as well. So I will just try and share the screen, which is it that you?
Yeah, that one's me.
So hopefully see this online. And hopefully you can hear us fine online. Any issues?
Yeah.
Okay, I'll hand over to Alastair. Okay, thank you.
If anyone's got their camera on and there is any issues with the audio, could you just tell us?
Yeah,
Audio is okay. Perfect. Thank you. Okay, so thank you for the introduction. My name's Alastair Wilson. I'm kind of the newest member of the Research Regulation and Compliance team. I've been in this for a month, so a little bit of a trial by fire. And the overarching theme of this is going to be: don't hesitate to ask us by email if you have any questions about anything I say. So first of all, we're just gonna I'll introduce you. So the team's quite small. There's Deborah Stewart, who's the head, Emma Jane, Sinead, and myself, and we kind of handle all of the research that involves the NHS and sort of the clinical side of things. Also healthy volunteer studies and student studies as well. We're just going to kind of broadly cover the areas that we look at in the research regulation and compliance team. We're going to start off with sponsorship, and this is a very specific thing when it comes to research. What kind of study approvals you'll need for your research, what kind of contracts you might need, things to consider are insurance, and I'm going to make one broad statement about data management before handing that over, and then some links to useful sources of information. So first of all, sponsorship. The important thing to know is sponsorship is not actually tied to the funding of your research. This is kind of a holdover from when, sponsorship was tied to the funding. The sponsor was the person who actually gave you the money, but that's not really the case anymore. The sponsor is the organization that takes on responsibility for the initiation and the management of your research. So the UK follows the UK policy framework for health and social care research. And so that encompasses all research that involves NHS staff, NHS patients, or their samples, tissue, or data. So sponsorship is really about who takes responsibility and cover for your research. Sponsorship decisions within the NHS, GGC, and the University of Glasgow are all based on the UK policy framework for health and social care research. This is available to read on the HRA website. It's not too long, it's not too complicated. And so if you're really thinking about your research and what might need a sponsor, what might not need a sponsor, because not all research does need a sponsor, I would highly suggest you look there. And later on, I'm going to link to a really useful resource called the Student Toolkit, which, regardless of its name, isn't just for students, and it can tell you if you require a sponsor, what kind of ethics you might need for your research. And there's another tool, which we link to later, which essentially tells you if what you're doing is research or not, according to the UK framework for health and social care research, policy framework. But within the NHS, GGC, and University of Glasgow, there are 3 different sponsorship models possible for your projects. So there's the NHS take on sole sponsorship of your study. The University of Glasgow takes on sole sponsorship of your study, or in certain cases, there's a co-sponsorship model as well, where the University of Glasgow and the NHS will sponsor your study. And there's various different conditions that need to be met in order for each of these different models to be applied. There's going to be lots of links through this, and hopefully we can share the slides out.
Yes, it would be to do that as alumni, but it was
yeah, so these are all actual hyperlinks, so you'll be able to go and find this information. But again, the policy on sponsorship and co-sponsorship arrangements is all on the University of website. Really short, you can find out what's going on there pretty quickly. But just to give you kind of an overview, the University of Glasgow will sponsor research where it involves only healthy volunteers. Recruitment doesn't.
sorry, I think that's me.
Feel good? Okay. Recruitment doesn't involve NHS facilities or an association with NHS patients. So that's, you're not allowed to recruit if you are putting up posters in an NHS clinic room, a waiting room. You wouldn't be able to do that without, under the university sponsorship university wouldn't take sponsorship where you're recruiting patients directly out of a clinic or recruiting NHS patients on the basis of their diagnoses or those kind of things. Research is conducted by a University of Glasgow student where the primary purpose is obtaining an educational qualification. So we'll take on sole sponsorship of studies where you're looking to get a master's or a PhD or other projects. And lastly, where tissues and samples are donated to the university by NHS patients, but they won't be returned to the NHS. So we can do things where you're taking blood samples from NHS patients, as long as they're going to be destroyed or stored by the University of Glasgow and not returned, the University of Glasgow can sponsor research in that capacity. The university will not, however, sponsor international research studies. We don't have the insurance for it, and you need to have a legal representative body in each international country in order to do that sponsorship, and the University of Glasgow doesn't have those arrangements, so we can't do international studies like that. Where NHS GGNC would do sponsorship for research, this is primarily where it involves NHS GGNC patients. So studies that make use of patient data provided by the NHS, studies that are undertaken at NHS facilities, including CRFs, and then again, studies that involve tissues or samples from patients, but that will ultimately be returned to the NHS for further processing or disposal. That's a kind of less common situation, but it does happen. And co-sponsorship, this is really clinical trials. So there will be a co-sponsorship agreement where it is a non-commercial clinical trial where the CI is substantively employed by the University of Glasgow. This is mostly going to be about regulated trials, things like trials of medicinal products or medical devices. The University of Glasgow is not set up to do things like pharmacovigilance or monitoring that are requirements for these kind of studies. So those will be likely to be co-sponsored or take on NHS GGNC sole sponsorship. So once the sponsorship arrangement has kind of been taken care of, your research kind of progresses into who's taking ultimate responsibility and then what kind of approvals and contracts you need to put in place for your research. This can be the time-consuming bit. So when you're thinking about developing your project, think about how long these kind of processes might take. We can't really ever give you a clear answer at the beginning of how long it's going to take because every project's different. So I think it's important to engage with, the research regulation and compliance team early, and we can kind of give you a sense of how long it's going to take. I give you a number, but we can give you a broad idea. But the first sort of approval that you need are ethics approval for the kind of research you're doing. And so there are two strands to the way that you can approach ethics. You can get NHS ethics, and that's required for research involving NHS patients, their relatives or carers, NHS data, and NHS facilities. And the way that you apply for that is through this website, the IRS application, and this is a long form that requires a sponsor review and sponsor sign off for it. And then the other strand that you can approach for your projects is MVLS ethics. So that's for research involving NHS staff, but not that one's a bit woolly. So I'll kind of gloss over that. But you can do projects with NHS staff as long as they're not recruited through the NHS specifically. You can go through professional bodies, or you can do personal contacts. But for projects where you're recruiting them via the NHS staff would have to go through NHS ethics. It's a complicated one, but the student toolkit's actually incredibly useful, which I'm linking to a little bit later, for guiding you between where that would go. So, and any project that involves healthy volunteers or recruiting participants from out with an NHS environment, all those kind of projects can go through the MVLS ethics system. Or just through the university ethics system more generally, if you're out with MVLS. Each college has its own ethics committee for different things. And again, this can be accessed through the university website, and there's the link for that. This is what I've been digging up. This is the HRA guidance and the student research toolkit. This is just an interactive PowerPoint presentation that you can download, and it's just a series of questions that you can click through, which is fantastic. First of all, it will tell you if your study's research. It will tell you if it needs NHS approval. It tells you if you need REC approval and what kind of REC review is required. And then it will be able to tell you whether or not you are able to carry out your research. So that ethics is the primary thing that for most research projects that you're going to need an approval for, but there are other organizations for specific types of projects that you might need to get approvals from. If you want to do work within the prison service, that has a separate approval process, same with schools. If you want to do data-only projects and access NHS Scotland data from Research Data Scotland, the safe havens are a trusted research environment in which you can do this kind of analysis, and they have their own delegated ethics, which is run through an organization, a group called the LPAC Committee. NHS Scotland Biorepository also has its own ethics delegated responsibility, so you can seek approval from them without having to go through a full IRAS application in certain projects. And if you want to do some development work for MRI scanning, the ICE building has a 7T MRI scanner, which also has a delegated authority to approve things. So it doesn't need to go through a full ethics review, but in certain conditions for certain kinds of projects, you can go to the CRIF at the ICE building. Depending on your project type, there are other kind of approvals you're also going to need. You're going to need NHS R&I and R&D management approval from each participating health board if you're doing a multi-centre site. And that applies to any research involving, again, it's research involving the NHS. So patients, relatives and carers, staff, data, facilities. But again, as I mentioned, there are qualifications for NHS staff there. There are ways that you can, no, I think you still, am I right in saying that you still need R&I approval? Yeah. But yeah, you would still need R&I approval if you were doing a staff project, even if you didn't need NHS ethics for it. There are also ways to use NHS patient data without consent, and you can gain approvals from various different committees and authorities. So you can apply for a PVPP application, which can give you unconsented population level data. There's the Caldecott Guardian again. That's a separate organization that you might need to get approval for using data from. And then in England and Wales, there's a confidentiality advisory group, which is very similar to the HSC PVPP process, but somewhat more complicated. But that's, again, for accessing NHS patient data without consent. you can kind of see that there's lots and lots of moving pieces. There's lots and lots of people that need to say okay if you're doing research with, particularly with NHS patients, and other people as well when you're looking at, NHS data. Alongside you gaining these approvals, you're also going to need to consider several different kinds of contracts. There's data processing agreements, data sharing agreements if you're working with multiple organizations, and the data needs to be moved between those organizations. If you're working with tissues or blood or other samples, you might need a material transfer agreement. If you're having to go down the co-sponsorship route, there's a co-sponsorship agreement and then a collaboration agreement as well. And another thing that you might need is a research password. If you don't have an NHS contract with any health board, but you plan to do research involving NHS patients, you might need a research password to do that. Some of these can be very generically covered by a document called an OID. Some of them need to be more specific, but that's all things that we can help advise you on with your project. Because I think one thing that's kind of key to consider is every project is different. Every project has different requirements, and we can really kind of help you through the process if you kind of engage with us early. We can tell you what you need, what you might not need when you're doing this. Something that you also do need to think about, and if you're filling out an IRAS form, is a specific question that they're going to ask you: what are the insurance arrangements for your research? And the clinical trial insurance covers research projects which are sponsored or co-sponsored by the university, either by students or by staff members, and is subject to approval by an appropriate ethics committee and approval of any contract by the University Contracts Office. The NHS has its own insurance, and that's called Sonoris, and it covers clinical negligence for clinical trials in the UK. So some of one of the questions in your IRAS application will be covered by Sonoris, or if you're an NHS member of staff, it will. The University of Glasgow insurance cover will indemnify actions of the employees, students, and affiliates, and cover the risk associated with the protocol where it's developed by University of Glasgow staff. Sinead is our insurance champion, so she can help answer any questions about that. But there are some important caveats to the university insurance policy. It requires us to notify of any clinical trial or interventional trial that's conducted outside of the UK. So if you're doing any elements of it outside the UK, involves pregnant women or children under 5, it's a large project, over 5,000 or more participants. These are trials of cell or gene therapy or gene editing, therapies targeting the brain, blood-brain barrier, cerebrospinal fluid, COVID, and then phase 1 first-in-human studies. But these are for specifically clinical trials or interventional trials. And it's not a problem if your trial does involve these things. You just need to contact us and we'll get in touch with the insurer. There might be an additional premium involved, but we just need your protocol and we'll need to go and get in touch with our insurance brokers. There's also a large list of, not a large list of exclusions, but a list of exclusions that there is no cover available for your project. So if you are concerned or you want some more information about the insurance requirements of your project, if you contact us on the RRC at glasgow.ac.uk with your protocol as early as possible, we can, confirm with you or, help you through the process of getting additional premiums, covering it. And kind of the last slide is the data management. And from our perspective, the thing that we see most commonly is no identifiable NHS patient data can be held in the University of Glasgow IT systems, except within the Robertson Centre for Biostatistics. That's the thing that comes up most frequently, and most frequently we have to comment on. So instead of stepping on Matt's toes, I thought that was something that we could just put out right. Here are some really useful links that have all kinds of guidance, all kinds of support that you can access online. And again, this will be distributed out, so you can just click on those. One to point out that's really, really useful is the University of Glasgow Code of Good Practice Strategy and Policies that has everything you need all online and accessible easily. We have good resources on the RRC office website as well, and that has our contact details on it too. So yeah, that's a really quick and generic overview, but I think the key thing to take away from this is if you have any queries, please just get in touch early. It's best that we know what's going on before it gets too far down the line, because it becomes much more challenging to change everything at the last minute rather than just addressing problems right at the beginning. I think there'll be time for questions at the end, but I'll pass on to Matt now.
Thanks for that, Alastair. So I'm Matt.
Hold on a sec. It's not changed in Zoom, so
What I'll do is I'll stop.
stop sharing.
Share and then.
No, click on that. There's there.
Oh, yes, yeah.
Click on that. I'll double check it on the laptop.
Is that right? Yeah, brilliant. Okay, thank you. Great. So my name is Matt. I'm from the Research Information Management team, and I'm going to talk very briefly about generic best practice around research data management. So when we talk about research data, we mean any information, whether that's digital or physical, which is required to underpin your research. When you're thinking about the university's policies and other policies that apply with regards to research data, we really do mean like anything that you might need to produce in order to demonstrate that you reached your conclusions is what we're talking about as things that are in scope. You might collect other forms of information as part of your project, which relate to how you contact your participants, project management information, and so on. You can definitely use the data management toolkits we have around data management planning to think about how you manage your stuff. But just bear in mind that when it comes to the policies, especially around data deposit and long-term retention of data, we're really only talking about the data that's of long-term value and underpins the conclusions of your there are lots of benefits to doing good research data management, which is why the university and funders have policies which encourage the deposit and sharing and reuse of research data. So we want you to have a good copy of your data which underpins your conclusions because it improves the integrity and reproducibility of your research. The funders are also especially keen on the sharing and reuse of data because this strengthens the research environment, mainly by allowing people to build on the data collection that you've carried out, which for them represents a better use of research funding. There are also benefits to you as individual researchers. We want to reduce the risk of data loss, not just in the sense of kind of, a catastrophic loss of your data, but also we want you to not come across your data again in 5 years' time and find that you didn't document it well enough that you can understand what you did and the decisions that you made in order to produce particular conclusions. But we think of this also as a form of kind of soft data loss. We want to ensure you comply with the requirements that apply to you. And also we just want it to be easy for you to write up your results. And all of this feeds into, well, I should say Ref 2029 now, but the people, culture and environment portion of the Ref is going to include quite a lot of stuff about open research practices, if not open data itself, then at least making the practices of your research more open and transparent and accountable. Funders' data requirements tend to come under this common statement of principles from UK research and innovation, which is that publicly funded research data are a public good and should be made openly available with as few restrictions as possible. MRC is very explicit about this. They say that award holders should seek permission from participants to make data openly available where it's reasonable and possible to do so. They won't penalise award holders for not sharing data at the end of a project if there's a real requirement that you shouldn't, but they expect that when you're seeking consent from participants, you should try and seek consent for data sharing if it's feasible. So the basics of data management are to write a data management plan, organise your data well with good documentation, prepare your data sets which underpin publications, deposit these in appropriate repositories, and cite your data where it's possible to do so. I'm sure everyone's familiar with data management plans, but just to recap, these are short documents which set out how the data arising from a project will be handled. We have a tool called DMP Online, which helps you to write and prepare data management plans. And just to give you a sense of where data management plans fit in with other processes within the university, this is the generic data management, data protection, and ethics workflow for non-clinical research. So clinical research, you go through the RRC and you follow the separate guidance that they have and that Alastair has spoken about. But for projects that are not involving clinical settings in NHS, this is the kind of generic workflow. We would encourage you to write a data management plan first, because it is a description of what you think is going to happen to the data while it's in your care and where it's going to be deposited for the long term. And then you'll need to look at the data protection paperwork. So every project which is handling personal data should have a data protection impact assessment, and participants should be provided with a privacy notice. At the point when you've drafted those, then you can start seeking ethical approval, taking into account the decisions that you've made in completing the DPIA. If your data processing is high risk, then you have to send that documentation to the DP and FOI office for review. They have an 8-week turnaround period at the moment. So you need to plan for this in advance of starting your research. If you're sharing data externally or internationally with third parties, then you need to discuss your contractual requirements with the contracts team. If you're using any software which isn't managed by the university, then you will probably also need to have a contract in place and look at the due diligence for data protection. You're using that software, and that's something that you can discuss with us when you submit, if you send your data management plan to us for review, but you'll probably also need to get the contracts team to look over the paperwork for your user license that you're using. So this is also something that you need to do in advance of starting your project. And then when you've got a final version of your data protection impact assessment, you have to submit a return to the university's data protection repository so that they have a deposited version of your data protection compliant paperwork. If you go through IRAS, my understanding is that you'll be directed to these steps, but not necessarily in the same order. So that's something that you can get advice from the Research Regulation and Compliance Office. Just one of general advice from us around when you're completing this process at the beginning of a project. If you're going through ethical approval for your research, then you should also seek consent from your participants to deposit the data at the end of the project. Something we see quite often is when they're writing the ethics paperwork, people will make a kind of false dichotomy between personal and research data. They'll say, we'll destroy the personal data and keep the research data. It may be that actually your research data is irreducibly includes personal data. In those cases, you should still plan to deposit it if it's possible to do so. If you have a requirement to keep personal data, don't tell your participants that it should be destroyed. That's really obvious, but we do see this come up a lot. Equally, don't promise anonymization of your data if it can't really be achieved. And we have some resources on our web pages about the differences between anonymization and pseudonymization of research data and the implications for storing and sharing that data in GDPR. If you are going to be depositing data, tell your participants up front that it'll be kept for at least 10 years after the research is concluded in an appropriate repository. When we receive data deposits to our research data repository, we'll be looking in your consent paperwork for explicit consent from your participants for data deposit. But if your participants will only participate in your research on the basis that the data won't be kept, or if you're working with data which can only reside in a safe haven, or which you have to return to the sponsor at the end of the project, that's fine, but it should be an exception rather than the norm. And this is something also that the funders will be looking for in the data management plan that you submit as part of your funding application. You know, like I said, MRC is very keen on data sharing, so they'll want to see that you're at least making efforts to establish whether or not it's possible. And they don't like it if you just say, oh, because this is clinical research, I'm not going to make any effort to work out which parts of this data are suitable for sharing. The way that we would like you to think about it is this Venn diagram, which is going to end up being concentric circles. So firstly, there's all the data that you produce in your project. Produce or process, I should say, because you might be receiving data from a third party that you process. There'll be a subset of that data which is suitable for deposit. You should try and deposit all of the data which underpins the conclusions of your research, but this isn't always possible, like I said, because you might have to work on data in safe environments or return it to the sponsor at the end of the project. And then there'll be a subset of that data which is suitable for sharing. Maybe it might only be the parts which you can anonymize. Maybe it'll be a reduced set of that, depending on what consent you've received from your participants. And then there are a number of other resources that we would expect you to also deposit. So documentation to accompany your data set, code, protocols, other non-data resources that might be deposited in different repositories. And then also you might be citing third-party data sets which you don't hold after the end of your project. So these are the kind of things we'll be looking for in a data management plan if you send it to us for review. But the important thing is, don't think of data deposit and data sharing as the same thing. First, think about what data you need to deposit to ensure the long term, to ensure that you can continue to prove the integrity of your research over the long term. And then there'll be a subset of that data which hopefully will be suitable for sharing for other people to reuse. Sharing doesn't necessarily mean open access. It might be that you deposit a data set which can only be shared once a data access committee has agreed that it can be passed on to a third party. Or in some cases, we might go back to the original approving ethics committee and ask them for additional permission to add people onto the ethical approval access. All of these are possible. Lots of these options will involve you having to do some planning before you start your research. So please talk to us as early as possible if you think that any of these situations might arise. I'm going to just skim over these, but we have guidance on our web pages about the organization of your research data, how to have good README files and demonstrate the provenance of your research. We also have lots of guidance on how to document your data to a kind of minimal adequate standard. The university has lots of storage areas that are suitable for research data, obviously with the caveat that Alastair made about storing NHS data, NHS patient identifiable data. If you're not sure where to store your data, then draft your data management plan, send it to us, and we can start a conversation with this. If you have some needs to store your data which aren't covered by the standard options, then the university has a research computing service which can help provide options and support you in finding somewhere that's appropriate to store and share your data. This is especially important if you're working with collaborators who are at different universities, because it may be that we need to set something up that would enable someone external to access your data. So when you come to publish your research, think about drawing together documentation, the data which underpins each figure or illustration or excerpt that makes it into your publication, and a README file which at least lists the contents of your data set. Once you have this, you should put it in a suitable repository and cite it in your publication using a digital object identifier. There are lots of repositories which are appropriate to store your research data. We have our institutional repository, Enlighten Research Data, which has storage which is specified to ISO 27001. That's the required level of information security certification needed to store some types of NHS data. There are also lots of other repositories available, including generic repositories for open access data, subject-specific repositories, and so on. If you need advice on where to put your research data, talk to us, and we can give that to you. This is what a research data repository record looks like. You can see that we link to publications, we give a DOI where you can cite the data. We link to funding, so it makes it very easy to report to research funders. Some of you will have gone through the research fish exercise, which just concluded this week. We push everything from our repositories that has funding into systems like research fish, also into PDR and promotion. So it makes it very easy for you to do those kind of reporting exercises. The data sets where the data will be open access, like in this example, we have files that are just available. If the data needs to be restricted for some reason, or if it's too large to deliver over the web, we'll have a request data button. And what happens when someone presses that button depends on the affordances of the data. So, you know, if we receive a request for data, which is it needs to go to an ethics committee, we'll pass that on. If we receive a request that's for open data, which is too large to deliver over the web, we'll just kind of ticket it and provide it through a different data sharing tool. This is an example of a data accessibility statement in a paper. It's a requirement for UKRI funding that you have a data availability statement in any publication. And we have guidance on our web pages about how to write good ones and what should be included in them. I'll just say that saying a data accessibility statement that says the data is available on request is not considered a data availability statement. It has to be a repository link, even if it's just a record that says, you know, to get this data, you need to go through this administrative process, but there needs to be something that's more robust than an individual receiving requests themselves. So the support that we can offer in the data management team, we'll review data management plans. We can do this as part of grant application and advise on costing research data activities into your awards. We're also happy to look at data management plans at any point during a project. It doesn't have to be at project initiation. So if there's just some aspect of your data management that you'd like to consult with us about in project, then we're really happy to do that. We have the Enlighten Research Data repository, which can also act as a research data registry. What that means is if you put data in a third-party repository, we can create a record for it where we don't duplicate the data, but it'll enable it to show up in your staff profile, feed into EDR and reporting to funders and so on. And we also offer advice and training on a very wide range of open research activities. So more widely than just data management, we also give advice on open research practices throughout the whole life cycle from project initiation publishing. There's a number of training courses available that you can find on our training web pages. My campus, we also do a number of ad hoc sessions. We do actually have a session next week on the 26th. We have the team from Research Data Scotland coming in to talk about how you can access Research Data Scotland data sets. So you can find that on the Research Culture Commons if anyone's interested in that. And the Research Culture Commons is generally where we'll put adverts for upcoming events. So please join that team if you haven't done so already. But similar to what Alastair was saying, the most important thing is if you have any questions about any aspects of data management or open research, you can just contact us at research-datamanagement@glasgow.ac.uk. We'll be able to give you some advice. So that's all my slides now. I think probably time for questions now.
Yeah, thanks so much. That's really helpful, and Alastair for presenting there. I think it's really useful. There's so much information, but it's really good to know how accessible you are and that you're really welcome to kind of email. And I think that's key for us getting it right from the very beginning and from all of our planning. So we're better reaching out to you earlier. I've got my laptop right, so have we got any questions online? You can put your hand up and unmute or put them in the chat. That's also fine. I can start with the questions in the room. Yeah,
Katie. Question. Thank you so much. That was really helpful. It's the 8+ week turnaround time, and I don't know if anybody can answer this question. 8+ week turnaround time from the DP and FY office. I mean, is there any plan that's going to be tried to be reduced? Because that's obviously like quite a substantial rate for lots of projects that we're having to wait for that.
Yeah, so they are currently understaffed and there's a post out advert. So hopefully that will help to reduce.
An ambition to try.
Yeah,
Because that would help so much if we knew it was just 2 weeks, for example, or it wasn't 8 plus.
yeah.
Yeah, because that creates a whole lot of.
Is it usually 8 weeks? I get a response from them sometimes because I ask them to review my, like if we do DPIAs for students that are doing work in the NHS,
Mhm.
I might email them sometimes and they answer me back. So I don't know if it is 8 weeks.
I think it
But
definitely can be.
it can be.
Yes, that experience. I know, because-
a long time.
Yeah. I think it's especially a problem for student projects because they're kind of by the time a student has decided what their project's going to be, especially at PGT, then they probably don't have 8 weeks before they need to start doing their data collection. So we actually ran a campaign last summer called "Get Your Ducks in a Row" that was aimed at supervisors of PGT projects. Yeah, and but the gist of it basically is that if you're I would encourage you, if you're supervising PGT projects, to try and front load as much of that stuff as possible, and if it's possible to kind of channel your students into like a small number of projects where lots of them will do very similar stuff, then you can, you can't write the paperwork for them because it's going to vary, but if you can at least get templates together that they can modify, then that's a good way of trying to reduce that burden. But yeah, it's the difficulty with that is it's a legal requirement, and so there's really no way to avoid any of that stuff.
One box. Not quite sure this. So if I download some data, for example, this. Data. They ask put the data in some security place. Is the university have this kind of
Sorry, no, go ahead. I'm just going to repeat the question online.
yes, some this patient imaging data.
I would say it would need to be anonymous.
Yeah,
No,
I mean for
kind of-
patient data, I'm going to hand over to you.
I'm just going to repeat that.
It has to be anonymous.
Yeah. Online might not hurt, might not pick it up. So it's around using patient data that's sent to you and the people sending it to you ask for it to be put into a secure place for it to be held. It's kind of for we've got quite a lot of data scientists working here, who are using large
So
work in that.
I guess there's questions about where it comes from. There are large data sets that are fully anonymized that are free to use that can get sent to you that don't have any requirement. There are some data sets that you can just download because they're fully anonymized and they've been put out into the public domain. Those are okay, you can use those. But if it's patient data that it has a requirement for security, the university IT systems can't hold probably any of the identifiable data. Anonymized data, I think we can hold.
Yeah.
We could hold an anonymized data set as long as there's no link at all.
Yeah.
You'll have to conform to university data security policies. So, don't put it on Dropbox, for example, but university Teams or the university SharePoint sites would be okay. But if there's if it's identifiable patient data and you want to hold it within the university, that has to be held at the Robertson Center. And there's costs associated with that. And they've got a trusted research environment that you can deposit the data to, and they can set you up with that. But there is quite significant costs to doing it that way. But if it's NHS patient data, the best place to put it is, work with someone in the NHS.
Yeah, the NHS.
Just try and put it in the NHS. Because you can hold it on the NHS Teams or in an NHS, in an NHS environment, and use an NHS login. That's kind of the best way to do it. But this also only applies to the NHS data. I think data sets coming from overseas is more complicated. I don't have a good answer for you there.
Yeah.
Do you mean for like moving it to be data sharing? You want to put it somewhere where other people can access it?
Yeah, some people.
That's more for you, isn't it?
Yeah, so
If
I
it was
think,
if it was anonymous, you could store it somewhere.
well, we could, so the first thing to say is it's very difficult to give guidance on this that's generic because it's really going to depend on the conditions under which the data is shared with you. So we would expect with kind of publicly available data that it would still be coming to you under some kind of license condition, which determine there's some kind of terms of use, which explains like what you can and can't do with it. So what we would normally do is first go to that and see what requirements there are. And then the second question would be, is this data subject to GDPR or subject to data protection legislation in the UK? So for all research that's conducted under the name of the University of Glasgow, even if the data are produced outside the GDPR territories, we would still expect you to comply with UK data protection legislation. So that only applies to personal data, obviously. So if it's anonymized, then that requirement falls away. But if it is subject to data protection requirements, then you'd need to go through the data protection process that I showed, doing a DPIA and looking at privacy notices for the people whose data you're handling. And then we would be asking, is it subject to, does it need to be subject to ethical approval for you to receive this data and handle it in the university?
We're assuming that it's not.
Yeah. So
images data.
It'd be complicated but doable.
Yeah, but then if the data is publicly available and anonymous and it's licensed in such a way that you have permission to take a copy and work with it, it becomes drastically simpler because then you just need to comply with the university's information security requirements, which are more about the confidentiality of data rather than about kind of data protection statute or like ethics requirements. So the short answer after that long answer is, if you have a specific case that you'd like to discuss with us, then the best thing to do is to send us the details of the data set that you're working with, and we'll be able to give you more advice.
Okay, I've got a question, but there's a quick question online. I think it was Research Culture.
Research Culture Commons, yeah.
Research Culture Commons cast. So that's for the training offers from the data management team.
Yeah, they also send an email roundup. So if I don't know if you have to sign up to that list or if it goes to everyone, but if you sign up to the teams, then you'll get the alert.
Yeah, there's quite a lot of useful teams out there across the university, like central sort of teams that I think people maybe aren't always aware of. I have a question, I think, kind of for Sinead and Alastair. So another hold up that we quite often have for our research is we've got ethical approval, but we still can't get NGSR. And it repeated like around our research group, it's backlogs and R&D approvals and who to talk to, then they pass you on to somebody else. And yeah, I don't know if you have any more luck or any particular contacts, or
There's
I
no
don't
good
have
at.
any particular example. Like, it's not affecting me personally right now, it has in the past, but I know some of my colleagues are really.
Is it because there's a lot of sites involved?
No.
Is it
I have heard that, but
R&D, GT&C, just one example, one study to get through.
I've heard that as well.
But it's a real hold up for us and the type of research you do. Katie, you've probably experienced that as well. And it's
And we don't even say it's 8+ weeks.
no,
It's
it goes
out
out
there and you
it goes into the ether, exactly, and you've no idea, and you chase it up and you get back and say, and somebody else is looking at it, but it's a different person you were speaking to before, and it's real, but that's a massive challenge because by that stage, we're really need to start getting data. We've really got ethics in place, and
Yeah, that's
someone asked me that, and I said, well, you would want to do a study that was sponsored by the university, and then you would have us helping you put it through R&D.
Okay.
But then it would need to be for like a PhD, or you need to change the way that you were creating your research, because we don't have any influence on
your research wisely.
we don't have any influence on the
Yeah.
R&I, but we can do the same job slightly if it was sponsored by the university in some ways.
I think it's a hold up. Like prior to this, I was a trial manager, and that was consistently an issue.
Yeah.
Right, like that was always the hold up, and that's what I was trying to allude to. The R&I management can be a big consideration. Like it, you know, specifically
Yes,
if you're
it
working with multiple health
Yeah.
boards, you know, you really have to build in that time into your project because it's just it's a black hole.
It's a black hole. I think that's what you can build in time, but how if we don't know how long the string is, do you know what I mean? How
Yeah.
much time to be built in? But maybe that's actually then more key advice to get from you guys at that time.
We work
And then our
with
sponsorship
smaller projects. So I worked
Yeah.
with Declan Sci students,
Okay.
and they can get approval within 2 or 3 weeks from R&I. So that must be a smaller group.
And it maybe goes to a very particular,
Yeah.
maybe and somebody's got that remit of
Yeah.
those projects rather. No, it used to be much clearer years ago. We had the remit for what was in the governance, and then just I used to find that. We're doing a study on X. We spoke to this person.
Yeah.
We're doing it, but I don't think it's. I will report back.
Sorry, we can't help. I don't know. Is there
Yeah.
anything we can do?
I don't think so. I think there's going to be obviously there's a new R&I director
Yeah.
who comes from the university.
Oh, it's okay, right.
Yes, it's Jessie Dawson.
Oh, is it okay? Right. Okay. Good. Yeah.
So
He's there.
yeah, he's MBLS ethics. Yeah. So he has a vested interest in smoothing out the whole process
Yeah. Okay.
because
That's good.
he was my boss on all those projects that the R&I held us up. So he's aware of.
Not determined, Pepe. Not
Yeah.
going into it.
Yeah, he's felt the pain of the holdups. So
Yeah.
I don't know. I don't think we can. There's nothing we can specifically do to help move that along.
Okay.
It's just it is an issue. It is a holdup.
Okay. And are there any more questions online? I think just to say you're going to share the slides, which is great. I think there's loads of really useful links, and I think it's really important for us as well to share with our PhD students and so on some of these slides. I recommend people listen to the slides. Just say thank you very much for coming and giving us your time. Thank you. And thanks to all of you for joining us online. Thank you.